Hi, I'm Nurse Barb. I'm a women's health nurse practitioner, and this is your daily dose on menopause and vaginal dryness. This is a topic that very few women want to talk about. It is very taboo, and many of us think that we're the only ones dealing with it. And if we just wait long enough, it will go away. But unfortunately, at midlife, as our estrogen levels decline, we start to notice a lot of differences in our body, and sometimes we don't really chalk it up to the menopause transition. Now, you may notice that when you're wiping yourself after going to the bathroom, it's a little uncomfortable, or wearing exercise clothes is really, really painful. You may also notice that having sex or anything penetrative in the vagina is either impossible because it doesn't fit, it's not very elastic, and it's not lubricating very well, or it's really painful and that you bleed after. Some women also notice that they're urinating more frequently, or they have a sense of urgency, and nobody tells us about this. Unfortunately, talking about vaginal dryness is just something most of us don't talk about with our friends, and many people don't even talk about it with their healthcare provider. I understand, it's embarrassing, and we think, well, we're the only one, but you're not. This is a very, very common issue. So if you're dealing with vaginal dryness, hang on, because there's a lot of things I want to tell you that you can do to make this better. First of all, let's just understand the biology. You have more estrogen receptors per inch around your vulva, that's the labia, and the vagina than virtually anywhere else in your body. And so at menopause, as estrogen levels decline, well, those estrogen receptors get really, really thirsty. The other thing that happens is that estrogen really helps your vagina have a normal metabolism. That is, there's a lot of glycogen for the normal healthy bacteria that live in the vagina, or the vaginal biome. Now, that vaginal biome is mostly composed of lactobacilli. And when there's not enough estrogen, that means there's not enough energy or glycogen for the lactobacilli. And guess what happens? Without any food for them, they pack up and leave. They don't even wave goodbye. And the problem is that those lactobacilli have been keeping your vagina very acidified with a very low pH of less than 4. And then that helps prevent the overgrowth of other harmful or pathogenic bacteria that can cause odor, itching, or burning. So without estrogen, not only does the skin get really, really dry, but it interrupts the normal vaginal microbiome, and we tend to get more infections. Now, if you have an infection in your vagina, remember, it's super close to your urethra, or the tube that goes from outside your body to your bladder. So many women not only have a little bit of odor from their vagina, but they're more prone to bladder infections. And it's all chalked up to, you guessed it, less estrogen. So if this is something that's happening for you, don't despair, and do talk to a healthcare provider who's familiar with treating women for this condition. It's all too common, but unfortunately, a lot of providers don't know a lot about it, so you may have to educate them. Now, you've probably heard about using a jade egg or a yoni egg and putting that in your vagina. And my advice to you is, don't do that. That has never been proven to help. And they're super expensive, and they're not going to do anything to correct the underlying issue. And the underlying issue is loss of estrogen or lack of estrogen. But you may not feel comfortable using that. So I'm going to give you a menu of options that you can try to help your vagina feel more moist and more flexible, more elastic, and less uncomfortable. Number 1, you may just try something from your pantry like coconut oil. That's right. Anything that you can use for cooking, like olive oil, almond oil, coconut oil, you can put on other parts of your skin to moisturize and lubricate. So after a shower, you might consider using a little bit of coconut oil. Coconut oil is a solid at room temperature, but once you touch it, it becomes warmed by your hands, and that makes it a liquid. And then you can put it on your vulva, the labia, and around your vaginal opening. You can also use coconut oil as a lubricant because it helps with sliding and gliding. But what happens if your vaginal opening is really, really small and you're trying to have intercourse with a partner or use a toy that penetrates the vaginal opening? Well, if the coconut oil isn't working and you've tried other lubricants, you may need to think about a vaginal re-moisturizer. That's something that is used ongoing, not when you're trying to have sex, but used ongoing throughout the week, week after week after week, to help re-moisturize the vagina. Now remember, this condition, vaginal dryness, never gets better on its own. I mean, I wish it did, but it doesn't. It just gets worse and worse. I have many patients who are in their 60s, 70s, and 80s, and their vaginas are so small, you can barely get a Q-tip in it. I call this part of life puberty in reverse, and that's because the loss of estrogen takes away all of those nice, fluffy, collagen-laden tissue and makes it super dry, super thin, and very easy and it's very easy for it to tear if there's any rubbing, friction, or trying to even wipe yourself. So this condition never gets better on its own. You can use coconut oil to lubricate after a shower. You can use it as a lubricant for sex. You can also use a vaginal remoisturizer, and there's plenty of them out on the market, but look for one that has hyaluronic acid in it. That's the same ingredient that many of us use in our skin creams, and that's because hyaluronic acid is a moisture magnet. So it attracts about 60 times the amount of moisture to that area. So what if that's not a good option for you? Or you want to use something like supplementing or replacing some of the estrogen or some of the hormones that your body isn't making anymore. It's a good idea. You might consider using something like the DHEA suppository. Now, DHEA stands for dihydroepiandrostenedione. And this suppository has been approved by the FDA. You can get this by prescription. It goes into the vagina every night, and what it does is it gets converted to estrogen in the vagina, but it doesn't circulate throughout the body. So women are not getting this DHEA into the rest of their body. They're not having side effects, but what they are having is a vagina that's more moist, more flexible, more elastic, and women often find that they're lubricating on their own. Now, one of the other side benefits that's been shown in studies for DHEA suppositories is that it can help sex drive, because in addition to having estrogen receptors around our vulva and vagina, we also have androgenic receptors, and those are those male type hormones that can increase your sex drive or your libido. The other thing that I recommend for my patients who can have estrogen, that is women who have no contraindications, is vaginal estrogen. And often women use this for 2 weeks and they already see improvement. There are lots of different ways to do that. There's small pellets, there's little capsules, there's estrogen cream. But I want to reassure you that there's no evidence that women who use vaginal estrogen have any increased risk of breast cancer. That's right. Using vaginal estrogen does not compromise your safety, and it doesn't increase the risk of breast cancer. In fact, I'm 62 and I use it myself because it's a normal and natural process for us to have less estrogen in our bodies, especially around our genitalia, and replacing it can help. The other benefit to using vaginal estrogen or vaginal DHEA is that it can help with some of the urinary symptoms. Remember, your vagina's here, your urethra, or the tube that connects the outside of your body to your bladder, they're right on top of each other. So when you help your vagina be more moist and the tissue become plumper and healthier, you're also helping the muscle tone that controls both your vagina and your urethra. I have many patients who have vaginal urgency or a lot of I have a lot of patients who have urinary urgency. They get up frequently through the night to urinate, or they're having a little bit of leaking. Sometimes all that's required is a little vaginal estrogen or vaginal DHEA. Sometimes those patients also need to see a pelvic floor physical therapist, which I'll tell you more about later. But in general, women seem to do so much better for all of these symptoms. Not only the vagina, but the urine. And subscribe to my videos. You can always go to my blog, nursebarb.com. Take care, be well, and I hope you're staying nice and moist.